Yes, you're tuned to Mustbe5radio. This is Safari Blend Sunday, bringing you the best of good high life music and a chat. Today we're honored to be talking to Dr. Wilhelmina Azu of North Dover OBGYN. She's a board certified obstetrician and gynecologist. And we'll be talking about cervical cancer. Cervical cancer. Please make sure you invite as many people as possible to tune in. Let's talk about this very important topic. So you're welcome to the studio, Dr. Wilhelmina Azu.
Hello, Mr. Magic. It's a pleasure to be in the studio with you today. I'm Dr. Wilhelmina Azu. I'm a board-certified obstetrician and gynecologist residing in Toms River, New Jersey.
Awesome. So I see the sign anytime I go to the complex where my doctor's office is, right? I see the sign OBGYN, okay? And I figured it's obstetrics and gynecology, right? Okay. Who goes to see an obstetrician and a gynecologist? And also, what is obstetrics? Right? Okay. At what point is it obstetrics? Do you go into one room and it's, this is time for obstetrics, and then you go to another room and this is gynecology?
Very good. So an obstetrician gynecologist, it's basically a health professional that specializes in female reproductive health concerns, like their problems. So, for instance, the obstetric component focuses on pregnancy up until delivery.
Okay.
And the gynecologic part, it's all the other reproductive concerns besides pregnancy.
Interesting. Thank you for clarifying that, because I was always wondering, when is it time for obstetrics and then when is it time for gynecology? Once again, you're welcome to the studio. So today we're talking about cervical cancer, right?
Yes.
Now, I deduce cervical cancer. The word cervix comes from cervical, correct?
Correct.
Okay.
You're right.
I probably have one. I just don't know where I have it. I probably have a cervix somewhere. I don't know where it is. So tell me where it is.
That's a very interesting question. Well, Mr. Magic, you probably do not have a cervix.
Oh, really?
If you are biologically a male, you probably do not have cervix. A cervix, typically, you find cervix only in a female reproductive system. So biological men do not have a cervix. So you will have to look very hard for your cervix, but more likely than not, you would not find it.
Okay, so we're talking strictly biological women, right?
Yes, strictly biological women.
Okay, and that's why we have to have grandma, mom, aunties, cousins, have everybody listening to this segment, right?
Right, yes,
okay.
Very important.
All right, thank you. So what is the cervix?
So the cervix, it's a structure, or let's say an organ, that is located at the bottom of your uterus. Now, the uterus we commonly refer to as the womb, where women carry their babies. So this structure is located, it's continuous with the womb, and it's at the bottom portion of the womb. And, it serves several purposes in a woman. For example, it allows you to have fluid going in and out of the uterus or the womb.
Okay.
And then it also helps with delivering a baby.
So this cervix is not like at the front of the distance, right?
Not quite. It's usually located slightly deeper inside.
Is this something I can see?
You cannot see with your naked eye by just looking. You have to actually feel.
Okay, so it's deep in there.
It's deep in there somewhere.
Okay, all right. And I
Not
don't have
too
one.
deep where you cannot feel it. So usually if you put a long finger in, you
Okay.
will be able to feel it.
Feel the cervix. Okay. So, how does the cervix become cancerous?
Yeah. So, with everything in life, any organ of your body at all can develop cancer.
Okay.
I'm sure it's very common knowledge. However, on the cervix, right, the cervix is like a muscular structure, like something that has muscles.
Okay.
And on the top of it is a thin layer of tissue that's made up of like two different kinds of cells. One of it is like skin-like, called squamous cells.
Okay.
And these cells typically multiply and shed over time, renew themselves over time. Also, you also have like glandular cells in there that produce mucus and moisture to the cervix.
Okay.
So these cells, like you said, sometimes as they are renewing themselves, can become infected with a very common virus. And this virus can cause them to become abnormal or develop cancer.
So it can just happen. It can happen to anyone. Is that it?
It can happen to anyone that gets exposed to the virus typically. And this virus typically can cause 99% of cervical cancers.
What is the virus?
So there's a
Is
very
it COVID?
common virus. It's not COVID.
Okay.
But this is a very common virus called the human papilloma virus. We refer to it as HPV.
Okay.
It's an abbreviated form of the human papilloma virus because it's a long word to say.
Right.
So typically when you see your gynecologist, they'll say HPV over and over. That's what they mean.
Interesting. HPV. Okay. I know it's a long phrase, so I'll just skip that. I'll stick with HPV. Can I get HPV by going to Stop and Shop?
No. You typically will not get HPV by walking into a building or
The
talking
meat
to
section,
somebody.
I
The
won't
meat
catch
section,
HPV.
no.
Okay.
Typically, you can get exposed to HPV when there is skin-to-skin contact of some sort. So some people, in general, will get exposed to HPV through sexual exposure.
Through sexual exposure, you can get HPV. So, I am married, right? I'm sexually exposed, right? Does that mean frequent sex I can get HPV, the HPV, the virus, or does that expose me to cervical cancer? Let's say with my wife, I'm going, 10 times a day, does that expose me?
So when we say exposure, not in that context. It means if you have been exposed to it in the past.
Okay.
So it more has to do with how many multiple partners you are exposed to, or if either one of you have had that exposure in their past before you get married. Then
Okay.
yes, you can get exposed to it.
And frequent sex, right?
With multiple partners.
Oh,
or
with
with
multiple-
a partner who have had a prior exposure.
Okay. So it's multiple partners. All right. So what are the symptoms of cervical cancer? How can I recognize that or something is wrong, or how can a woman recognize this?
So typically, it's very tough for anyone walking and not having been examined by a doctor to know that they have cervical cancer.
There's no
because
sign?
when it starts very silent. You just don't know. By the time you notice that something isn't right, you're probably in some advanced stage. But there are a few things that may happen to you that will make you think that something isn't right with your body. For example,
Okay.
the person may start noticing that their menstrual cycles the pattern has changed. Sometimes also after having a relation, they may have some spotting or some abnormal bleeding.
Okay.
Also, they may notice a change in their vaginal discharge. It could have a change in their odor. It could be bloody. The color may be different. And that can cue them to, this is something is not right. Let me talk to a physician about it. Also, sometimes you just feel unwell, like you feel sick. And by that time, it's probably in the advanced stage when you start not feeling well. And some people also can feel like they've having pain when they urinate. And that can all cue you into something being different.
Right. Okay. So you've you just feel not right.
You just don't feel right. By the
Yeah.
time it's full-blown cancer.
Interesting. Now, can you share some statistics about cervical cancer? Is this something we should worry about? Is it maybe 1% out of?
Actually, cervical cancer is very common worldwide. Cervical cancer is really common. For example, let's say like in 2020, right?
Right.
An estimation of about 600,000 new cancer cases worldwide of cervical
600,000.
cancer,
Okay.
yeah, and about 300,000 deaths worldwide. So it's really common, especially in developing countries where screening it's not very common.
Right.
Most people end up with cervical cancer death just purely based on lack of care or exposure to testing, or exposure
Right.
to testing.
Right.
Even in the United States, we get about 13,000 new cases of invasive cervical cancer and about like 4,000 cancer-related deaths in the United States. So this is very important. This is very common. And
Right.
there's several ways that we can prevent it, several simple ways you can prevent it from happening.
Okay.
So it's very important that we talk about it.
So you did mention screening. Now, last week we were talking to Dr. Osafo and John. We're talking about prostate cancer. And one very important thing that came up was screening, right? How do you test for cervical cancer?
So cervical cancer testing is very simple.
Okay.
It basically starts from you deciding to see your OBGYN or even your primary physician, because some primary physicians do the testing for their patients in areas where there is no local OBGYN.
Right.
And when you see that your physician, they will first do a complete physical exam and then focus more on your pelvis. And while they're doing the pelvic exam, they will look at the cervix and then do a few testing. And the testing, we collect some of the cells on the cervix and send it out for evaluation. And then also we test for the human papilloma virus.
So can I walk into Rite Aid and say I want to do a test or a screen?
If they have a doctor there who feels comfortable doing the testing, like if let's say they have a clinic in the Rite Aid, these days some of these pharmacies have clinics in them, then yes, you may be able to get a pap test done, but typically it's done in a doctor's office.
In a doctor's office. So it's best to, go to see your OBGYN.
OBGYN
correct?
or your primary physician.
Or even your primary physician.
Some primary physicians do pap testing.
Okay. All right. I have a question here from a listener. I know it's going to come down the road, but I want to just address it now. Do they have vaccines or shots for HPV? And how do you get these shots or injections if you're over 40 years old?
Yes. So luckily, we do have vaccinations widely available for the human papilloma virus.
Okay.
Now, we do have 3 different kinds of vaccines, okay?
Right.
And some of them focus on high-risk components of the human papilloma virus, and some of them also does high-risk and low-risk. Okay. Typically, when you see your physician, be it a pediatrician or your OBGYN or your primary care physician who carries the vaccine, they will give it to you. Now, the recommendation is for the vaccine to start as early as 9 years old. So routinely,
Did you say 9 years old?
9. So routinely, between age 9 and 12, both male and female children can be vaccinated against the human papilloma virus. Now, if they don't get vaccinated at that age, you can always catch up until age 45. So in the United States, it's recommended that up until age 45, you can always catch up on the vaccine if you haven't been exposed already. Now, ideally, you want to get the vaccine before exposure, and that's how can we give it to children, both boys and girls. And with the hope that in the future, this particular virus will be endemic because most of them will be vaccinated, and hopefully when they get exposed to the virus, they have a better chance of fighting it off and not developing the disease. or cervical cancer.
Okay. So a listener says, wow, it's a good thing you can't get it from frequent sex. All right. So thank you so much, Dr. Wilhelmina Azu. Now, I have another question here from a listener. It says, what is the name of the test you should be asking for if you want to test for either cervical cancer or you want to do the screening?
Okay. So when you come in for your exam and we're doing the testing for cervical cancer, we do a test called the papillomastoid smear.
Okay.
Pap smear for short.
Oh, that's the pap smear.
That's the pap smear.
I prefer pap smear to
The
whatever
big
you
word.
said before. Yeah.
And then in addition, we also do screen for the human papilloma virus. So depending on your age, we may do the pap test only,
Right.
or we may do the HPV test only, or we may do both based
Okay.
on your age or your risk factors.
Okay. Thank you so much. So today we're discussing cervical cancer. Now, we're trying to keep it as family friendly as possible, but there may be instances where we may have to say some words. So please, if you have your little ones by you, if they start asking you what is this and what is that, know what to tell them. But we're trying to keep it as clean as possible. And also to all the wives and the girlfriends and all the, it is clear that frequent sex does not cause cervical cancer, but if it's with multiple partners.
Exactly.
Or you got
Multiple
exposed,
partners. Yes.
in a previous lifetime. Okay, so pap smear. Now, you talked about getting screening from 9 years old. Is that correct?
Yes.
Okay.
No, getting vaccinated
Oh,
from 9
getting
years. Not
vaccinated.
the screening. The screening is not 9 years old. It's
Okay.
way older than that.
Okay, getting vaccinated from 9 years old. And this is available anywhere?
It's available at the pediatrician's office or at the OBGYN office.
Okay. So listeners, if you don't know about this, please find out from your primary care physician or your pediatrician and find out if this is something you want to do, or just ask them, that there's a vaccine out there to prevent HPV, correct?
Yes.
Okay. So, how often should you get screened?
So we do have different guidelines that we follow for the screening. For most young women up until age 30, we frequently screen them, basically every year, because those are the group of women that are still having different partners,
Okay.
most likely not married, so they could have a higher risk factor for as being exposed to the virus. Between age 30 to 65, we change the frequency of screening, and it's all based on your risk. It could vary anywhere from every year to every 3 years to every 5 years, depending on whether we screen you with the HPV in addition or HPV alone.
So the older you get, the less likely.
The older you get with the same partner,
Right.
the less likely you have of developing cervical cancer.
Okay. Are there any risk factors for older women, say 70 plus? Are there any risk factors?
Women, say 70 plus, that are widowed, have newer partners, or are exploring different relationships, still have that risk of developing abnormal cervix, like
Okay.
pap smears or cervical cancer.
Okay. Interesting. Let's see. I see some questions popping up. This one says, can grown adults get it if you are sexually active and you come into contact with the virus, correct?
Yes.
You can-
Actually, the older you are, the high likelihood of you developing cancer. If you are not with the same partner or with a partner that has not been exposed. But if you are with somebody who's been exposed, chances are if you get exposed and your body doesn't fight it off, it can develop to cervical cancer as you get older, because your immune system is not as strong as when you were younger.
Okay. So with the HPV, right? Ajoa, let's just say Ajoa, is infected with the HPV, right?
Yes.
What next? Like between getting the infection, not getting treated, okay? When does cancer set in? Give us that scenario.
So let's say Ajua gets exposed to the virus and Ajua sees her physician. Her physician does a pap test. A few things can happen. The pap test results and we come back saying Ajua is normal. Ajua have some slight abnormal changes to the cells, or Ajua has precancerous cells.
Okay.
Or Ajua has cervical cancer. So based on where Ajua falls, we can offer them different therapies. But the virus is a very slow growing virus. So it can take from 3 to 7 years for it to develop into full-blown cancer.
3 to 7 years.
3 to 7 years.
Without any sign.
Without any sign. So that's a long time for this slow-growing virus to stay in your body and cause problems down the line. That's how come frequent testing and screening is very important in somebody who has been exposed. Because the sooner we offer treatment to the patient, the higher likelihood is it for us to cure the disease or decrease their risk of ever developing cancer.
Okay, so we're talking screening. We're talking about going to see your primary care or your OBGYN, right?
Yes.
Is pap smear, I mean, when we say pap smear, the ladies know what we're talking about, right?
Yes.
Okay. Is it effective in diagnosing cervical cancer?
A pap smear is a very simple test and very effective in diagnosing cervical cancer. You know, anytime we do a test, there's a chance that the test may come back and say that, okay, you truly have the disease, or maybe we missed the disease, meaning that it's falsely negative when you actually have the disease. But because we do have that frequency in place, more likely than not, we will, and this is a slow-growing virus, at some point we will be able to catch the virus, because besides just doing the pap test, we also test for the human papillomavirus. So when we collect the specimen, we spin the cells and extract the DNA of the virus from the cells.
Okay.
And that can tell us whether, you should watch this patient closer, or you can let her be and test her every 3 years or every 5 years.
Okay. So how long does a pap smear take? Does it take a long time?
A pap smear is a very, very quick test. By the time you blink, it could be done. I mean, bear in mind, you're still having a complete physical. So when you go into the physician, you shouldn't expect her to just walk in and out, in seconds. But we do a complete exam. We do a complete exam of your pelvis as well.
Right.
So by the test itself, where we're collecting the specimen, is very quick. And then we feel the uterus, and we feel your ovaries, and we make sure that everything is normal.
Make sure the engine is running
Everything is running right.
Okay, awesome. How often do you see this in your practice? People with cervical cancer?
With abnormal cells, abnormal pap test results are very common. It's really, really common. But because the body has the ability to fight the virus for us, they are easily treated. Your body can clear it for you over some period of time, or we can intervene very quickly and remove those abnormal cells.
How do you remove them?
So we have different treatment options. You know, first, let's say your result comes back that your cells on the pap test is abnormal. Then we do further testing. It's a big word for looking at your cervix closer, called the colposcopy. The colposcopy means basically me looking at your cervix with a microscope and taking spot biopsies. The cotton tissue biopsies, we take a few spots that look like they have different changes to them. And then we send them out for further testing. So that would come back and tell me that, okay, you were right, there is HPV, there is precancerous cells, and yet it's that's far into the tissue.
Okay.
Or the person has cancer.
Right. Okay. Now, walking into your doctor's office and requesting for a pap smear, do I need any special type of insurance for that?
So the pap smear is very widely available, And it's a very affordable test. Typically, insurance covers the pap test. It's considered basic. So
Okay.
insurance typically covers it. But let's say you're uninsured. It's a very affordable test. So the test itself, so like your financial situation should not deter you from getting
Should not
tested.
deter you.
Not
Okay.
at all.
Okay. Now, if okay, so I'm gonna put this differently. So at 9 years old, right? A lady gets the vaccine.
Yes.
Okay. Is it foolproof? Once you get a vaccine, you can go hanky panky, like one night stands, jump on trees, and you're fine.
So, like everything in life, the vaccine helps to protect for some. So there are several strains of this human papillomavirus. We can count up to like 100 of them, but
100 strains.
different strains, yes.
Okay.
Some of them are what we call high risk, and we use a medical term called oncogenic, meaning like cancer typical.
Okay.
And some of them are low risk, and the low risk one typically cause warts. Now, the first two vaccines that came out, one of them will cover 2 strains of the virus. The other one came out covering 4 strains of the virus. Now we have until 9 strains of the virus that it can cover. That leaves a whole lot of other viruses that we don't cover these days with the vaccine.
Okay.
So even though the vaccine helps with the most common types that we can identify, you can still get exposed to other high-risk types that if you don't have a strong immune system, you still develop the disease.
So you did mention warts in there. If I find a wart, if a lady finds a wart, does that mean?
So if a lady finds a wart, they should be suspicious for other kind of of being exposed to other viruses. If you see a wart, then chances are maybe you've been exposed to other high-risk types. Get checked. And
Get checked,
also
okay.
get checked anyway, because the wart can easily be removed. If it's not removed, it can multiply and get worse.
All right. So if a pap smear is effective screening, why do we still see cervical cancer?
Because unfortunately, a lot of people don't come in for testing. And in as much as we do have the vaccine, a lot of parents are not vaccinating their children. A lot of young adults are still not vaccinated. So that's how come it's still so common. Now, this virus is very common. I mean, I
Right.
can't even compare it to COVID, but if you line like 5 people up in this room, 4 out of 5 of them have the potential of being exposed to this virus in their lifetime. That is very common.
Okay. Would you give your daughter, if you have a daughter, would you give your daughter the vaccine?
As a health professional, I have full confidence in the vaccine.
Okay.
The vaccine has been studied and proven to help protect, to some extent, those strains. And being that typically a female being exposed, they have no idea who their partner has been exposed to in the past. Their partner themselves may not even have an idea that they have HPV. So the only way to protect them or yourself is to be vaccinated.
Okay. There are lots and lots of questions coming through. If I'm with a partner, right? Where does the HPV, is it in the woman or is it in the man? Like, how does it come up? And if she gets infected with the HPV, does that mean the guy is also infected?
That's a very good question. So it has to come from somewhere. Now, remember how I said in the beginning that we have a thin layer of cells that cover our cervix? The same way the man also has a thin layer of cells that covers their body part. So
Okay.
this part can also have the HPV lurking in that area. So the man can be exposed to the virus from a prior partner, carry it and not even know.
He just
that
be a
they carry
carrier.
it. Just a carrier. And because he's not getting a pap test, he will never know that he's carrying until his partner tells him that, I was a virgin before I met you, and now they tell me I have this virus.
So that means he gave it.
That is the most likely source.
Are you blaming guys?
I'm not. No, I'm not blaming. I'm just saying that most of the time you can't tell who you were exposed to.
Right.
But let's say that was your first partner, then you can have a sense.
Okay, so the guy is a carrier, right? Let's
Right.
establish that he's a carrier. Well, he doesn't have a cervix, right?
Right.
How is it going to affect him?
Good, very good question. So because he doesn't have a cervix, how is it going to affect him? Well, it can affect him by him having like the warts. You can have the warts
Okay.
on that area.
Okay.
You know, sometimes based on certain kinds of sexual relationship that you may have, it can get you can get exposure in your mouth, your neck, and they can develop neck and throat cancers from that. Sometimes they can even develop, cancers down there in that area of their body. Because children are listening, I can't be too explicit.
You mean the back
side, yes.
Okay. All right. Now, interesting. Intense, very interesting topic. But this is Safari Blend Sunday. We're going to listen to some music, and we'll be right back.
Safari Blend Sunday, the best of curated high life music on Mustbe5radio.
This is
Mustbe5radio.
Safari Blend Sunday, bring you the best of high life music and a chat. Very interesting topic. We're talking about cervical cancer today. We have Dr. Wilhelmina Azu of North Dover OBGYN, board certified obstetrician and gynecologist, answering our questions. Now, for today, towards the end, we'll open the phone lines. If you have any additional questions that we have not discussed, and the number today is 848-224-2533. The number again is 848-224-2533. I'll let you know when the phone lines are open as we're still discussing questions that are coming in. Shout outs going out to TKB. It's also going to Mrs. Sonia Butchwe, listening from Accra, Ghana. Happy Sunday to you. And thank you for everyone sending me questions. So yes, we'll be going back to the interview. Welcome again, Dr. Wilhelmina Azu. How are you feeling?
I'm feeling great, Mr. Magic. Thank you.
I feel like we're bombarding you with so many questions.
This is a very interesting topic for me. It's really dear to my heart. So I'm really excited to talk about it.
All right. So my next question to you. Now, some of us were born here in the U.S. or, foreign land. Some of us traveled from our, local countries, Ghana, Nigeria, and we're now living in a foreign land, okay? So let's say a listener says they grew up in Africa or other countries, right, where the vaccine, the HPV vaccine, was not available for the younger, at a younger age, all right? Can they still get the vaccine if they are older? Let's say 40 now. Can they get a vaccine?
You can get the vaccine at any age, although the typical recommendation now is up until age 45. Basically, that's only a guideline that ensures that insurance companies are more likely to cover if you want to have the vaccine. But you can have it at any age, but the recommendation now is up to age 45. It does not mean that once you turn 46, you will not benefit from the vaccine. So let's say you grew up in a country where it was not available and you're here now and you want to catch up and get the vaccine, you should. Even if you feel like you've been exposed to the virus, like a doctor has told you that you have one or two of a particular strain, or you have a high-risk type, but they couldn't tell you which type, you can still get the vaccine to protect you against others if you're not in a stable or what we call a monogamous relationship.
Right. Good. Thank you. So we've established the fact that it's not only the guy who could bring it. It could also be the woman.
It could also be from the female.
Okay.
Because the female could have been exposed and not know. Until they get tested. For us, because we get tested frequently, we tend to know. But the men don't. They have no idea. It's not like the PSA test like we discussed last week where you can have a blood test and have it confirmed. They only get the information from us that, my doctor said I have been exposed. So that means that you are likely exposed as well, or you were likely exposed in the past. Okay.
So clearly no symptoms. Maybe warts, right, down there. Right?
Maybe if you're exposed to a low risk type.
Okay. Do you know of a local name for this? Is there like a local name, like back home from Ghana, or do you know anything like that?
Interestingly, I do not. I just know them as being called as warts. I can use a big medical term. We call them condyloma medically. Okay. But generally, people refer to them as warts.
Okay, thank you. So back to the scenario where the woman has, say, the woman is recently diagnosed, right, with cervical cancer. Does that mean game over? No more game for the, no more, game?
Not at all. So once, let's say you come to see your physician, like I alluded before, you get a testing done and we tell you, oh, maybe you have precancerous cells or you have cancer. If you do have precancerous cells, we can do 2 different kinds of surgeries to remove them for you. Let's say the cervix, the precancerous cells have progressed a little bit further, we can remove them. If they are mild, we just let your body fix it over a period of time. But we do have different treatment options way before it becomes cervical cancer. Once it becomes cervical cancer, then you go through the process of staging, and then treatment is offered based on your stage. But let's say that you don't have the cancer yet and you have the precancerous lesion, we do 2 different kind of procedures that can help to remove them. And they are very big words. One of them, we say a leap. You may hear a doctor say a leap, which meaning like it's a loop that we use. We use electrocautery to excise the lesion. Okay. And then there's something else we call a cold knife cone, meaning we go into the cervix and remove a cone-like portion of the disease from the area. Now, we just don't blindly do it. We put different chemicals on the cervix to tell us that, okay, these are the abnormal areas. And based on that, we tend to make sure that we include every kind of abnormal cells that we can potentially see.
Interesting.
Now, once that is done, most of the time, 90% of the precancerous lesions can be removed. Sometimes people get re-exposed after that, or sometimes you can have some that lay dormant and then over a couple of years may come back. And then at that time, depending on the level of invasion, we may tell you, okay, you need this and that kind of treatment options.
Okay, we'll come back to treatment options in a bit. But your partner, that's the lady, right, has been diagnosed with HPV and summarily cervical cancer, right?
Yes.
Business can still go on as usual. Do you have to be a little more careful, or you can't go rough? You can't,
It depends. So, when we say cancer, we're saying the cells have changed, they've multiplied. Sometimes they grow different things on the cervix, and those things, when tissue become cancerous, they tend to break down.
Okay.
So those things can easily break off and cause bleeding. So just by having that alone can make it difficult because of the type of bleeding that you may have by engaging in relations. Or you could have pain in the pelvis. That can also make it very uncomfortable. But once you have treatment, you should be better and you can go back.
Okay. All right. So we've clearly established that cervical cancer has to do with a biological woman, right? A man cannot have cervical cancer unless you mess with your, with stuff going on where people change their sexes and all that. It seems that breast cancer detection and recovery is far advanced than cervical cancer. Is that true or not?
I wouldn't say that because there are different parts of the body.
Okay.
So I won't say that because a lot of women do go in for pap testing. Mm-hmm. So as long as you do show up for exam and we do keep an eye on your test, we should be able to easily detect it sooner than later. So comparing it to breast cancer is comparing apples to oranges. For women who have breast cancer, they also have to have the testing done.
Okay.
So women who does not go in for testing have a higher likelihood of having the breast cancer hide than not know till it's too late.
Interesting.
But we also have very good treatment options for cervical cancer.
Okay. I have a question here. Cervical cancer, the cervix has to do with the engine down there, right?
Yes.
Okay. The front engine, right?
The lower end of the womb. Sometimes we refer it to as the neck of the womb because it kind of like helps to move the womb around.
All right. Okay. So, a question here. Let me see. It says, can a man get the virus from a woman who has been exposed through oral sex?
Yes. Yes. If it turns out that with engaging in that, most people don't just alone engage in oral sex. Most of the time, you do engage in both.
Right.
So if the woman has been exposed, yes, you can move it back and forth in both areas.
Doesn't matter which way you go. It's
Doesn't matter which way. Even men who have relations with men also get exposed to that virus, and it can cause cancer in those areas.
if not treated, cervical cancer can kill, right?
Yes. If not treated, cervical cancer can easily kill. It's very sad because it's one of the few cancers that we can prevent. So, yes.
It can be prevented.
Yes.
Okay. Kindly go over the treatment, the different types of treatment again.
Okay. So, we do have cancer cells that we treat using like I said before, the LEAP procedure or the cold knife cone biopsy. Okay. Besides that, let's say we tell you that, okay, you do have full-blown cancer, okay? Then you have to go through sometimes some imaging studies to tell us how far the cancer has spread. We also do a very thorough pelvic exam to give us an idea of what other organs it's including. Then after that, you will go through surgery, and the surgery helps us to stage. Sometimes it's a simple surgery. If it's a young female who the cancer has not spread to their ovaries, we may take out their womb and leave their ovaries behind. Or sometimes you have to have everything removed, including portions of other body parts.
Okay. All right. Now, treatment, let me see what.
And, that kind of hysterectomy, we call it like a radical hysterectomy, where we're taking out your uterus, your ovaries, the cervix, lymph nodes, sometimes portions of the bladder to make sure that all the disease is removed.
All right. So, Ajua, right? Ajua, for the purposes of this, we tried to get a patient, but it was so tough to get someone to come on live because the few people that we were able to talk to were at bad stages of the cancer. So it was not right for, to bring them on because their health condition was not great. Okay. So for the purposes of this interview, I'm just saying the name Ajua because it happens mostly to women. Will Ajua be able to have children after she's gone through treatment? For instance, if her uterus has to be taken out, will she be able to have children?
Yes, so this is very important. So let's say Ajua's uterus is taken out, but I just want to go back, okay? Let's say the person has precancerous lesions, right, on the cervix, and we do those two simple procedures. Most of the time, we're keeping the womb so they can carry, and we watch them closely during pregnancy because their cervix will be shortened. So we watch them for cervical shortening and just to ensure that they don't end up delivering the baby too early. Okay. Now let's say they have the cancer and we have to take out the uterus. Then we have them do several imaging studies. One of them is, we do ultrasounds, we do CAT scans, we do MRIs, depending on the suspicion, and sometimes a PET scan to tell us how far the cancer has spread. Let's say the person is only 21 and we see that the cancer has not spread to her ovaries or her lymph nodes or anything like that, then the discussion will be had with her as to retrieving some eggs and storing the eggs somewhere so that in the future she can use her own eggs for somebody else to carry a baby for her.
Okay, because she doesn't have
the womb anymore.
Right.
Yes.
Right.
Otherwise, if we end up keeping her uterus because this cancer is so localized to the cervix, she has a slight chance, but the cervix may be too short to carry full term. So some of them we do procedures to put like stitches at the bottom of the cervix to help keep the baby inside till we think it's safe enough to remove and have a baby.
Okay. So not so much in terms of symptoms, right? When we talk about cervical cancer, and then you recommended a pap test every year. Is that correct?
Yes and no, depending
on
the
the
risk
age
and your age.
Okay.
So young people, because most of the time they still finding themselves, they're not settled, they're not in monogamous relationship, we tend to do the pap test yearly.
Okay.
Then beyond age 30 to 65, that's when we start spreading.
So for a lifestyle, right? For somebody who is very active at night, and if I say very active at night, they stand at the junction and
Yes.
go. Okay. Would you recommend more testing for somebody like that?
Yes, those people have a higher likelihood of being exposed.
So say once every 6 months,
So
or
let's say this person comes in to see me and they tell me this is their lifestyle.
Right.
More likely than not, I'll do it every year. But I'll also test them with the virus.
okay.
If the virus is negative, we can choose to spread it out if they tell me they're using protection every time. Or we can still do every year. There's no hard and fast rule per se. You just have to individualize the care you give each woman, because some of them, the next person could be the one that they get exposed to.
Okay. So STDs, right? Sexually transmitted diseases. HPV, does HPV fall in that category?
Yes, HPV sadly falls under STI, sexually transmitted infections.
Okay.
Yes.
What is DES exposure?
Good. So DES, it's a big word for a medication we call diethylstilbestrol. Okay. Now, this medication was used back in the days, in the 40s till 1974, to treat women that were having miscarriages and shortened cervix. And over the years, we realized that those particular women were having babies that were developing a particular type of cervical cancer.
Okay.
Now, the medication having been used in the United States for over 30 years or close to 40 years. So it's very rare for us to see those cancers these days. And it only causes about 1% of cervical cancers. But if, let's say, your parent tells you that, by the way, I was giving this medication while you were in my womb, then we have to do more frequent pap tests for you.
Okay. Now, Safari Blend Sunday, we're talking to Dr. Wilhelmina Azu. We're talking about cervical cancer. She's told us where the cervix is, how you can get it, your risk factors, and she's also talked about screening, how screening is important, at least once a year, but again, depending on your age and how active the person is when it comes to, playing games, right? Okay, so is there a lifestyle that you recommend if somebody has been diagnosed for cervical cancer? Would you say they should exercise more? They should, walk?
Yeah, so for every cancer, once you get a diagnosis, you want to eat healthy, maintain an active lifestyle just to boost your immune system to help you fight the virus.
Right.
But more importantly, people that smoking can increase the progression of the disease. So if you smoke, one of the things you must do is to stop smoking once we're told that you have cervical cancer.
Right.
Please do not smoke at all if you can help it, because if you get exposed to the virus, there's more likely than not you could develop the disease, cervical cancer.
What about alcohol?
I don't have, well, alcohol on the whole is also one of those lifestyles that we do encourage people to, we caution people to do in moderation, because that can lead to other things that will put you at risk of a compromised immune system.
I see. So I'm going to let me answer this question. Are there any alternative or complementary therapies that could be helpful in preventing or treating cervical cancer? Any alternative or complementary therapies?
Yeah. So like I said, because this is a a very slow-growing virus, and it's a virus. So unfortunately, we do not have antibiotics for viruses per
Right.
se. We do have antivirals for viruses. However, when it comes to human papillomavirus, we don't have a designated drug that we can give you to treat it completely. But we do have any immune boosting supplement at all that you take that can help your body build the T cells that you need to fight them for you. So sometimes we tell a patient, increase your 1-a-day vitamin or your B complex, or there's an amino acid called lysine that helps to boost your immune system for viruses. We may tell them, take more of that to help your body. But
Right.
there's no specific prescription that we can write for them to take to stop the progression.
Interesting.
Just basically building your immune system.
Okay, so at age 9, right, Ajua got the vaccine in Ghana. Okay, she's 9 years old. She doesn't remember anything, right? Decades have passed. Parents long gone. No medical records to trace, right? So she doesn't. She didn't even know that she got the vaccine. She's now living in a different country. Can she get the vaccine again?
Good question. So when the vaccine was first developed, the recommendation was that it was protective for 5 years.
Okay.
As of now, we don't have any newer recommendation beyond the 5 years. We still think it's protective. But for the average, commonly, vaccines tend to protect you for like 5 to 10 years.
Right.
So if somebody has had it for over 10 years, can they have like a booster or revaccinated? The potential is there, but we don't have guidelines for that right now. So I
So-
cannot say on air that she should have a repeat vaccination, but I'm sure it's going to be coming up in the future.
But otherwise, you said it's good for 5 to 10 years.
As we know. For
5
now,
years.
5 years.
So after
but
5
can
years-
it still be protected beyond that? The potential is there.
Okay, so after 5 years, she can go get another one
No, I don't have guidelines for
for that. Okay,
Yes.
okay. It's not
So
like the COVID where
it's a COVID where
every
every
6
6 months
months
you can get it. We don't have guidelines for that, but we think that the potential is there to be protective, or for our young children that we give at the age of 9 to be boosted, but we don't have a boosting criteria yet.
Okay, so Ajo has a history of abnormal pap smear tests, right? What additional tests or procedures does she have to undergo?
Okay. So like I said before,
Right.
once she has abnormal pap test, then we do that big word called the colposcopy, which is
colposcopy.
looking at the cervix with the microscope and getting further biopsies
Okay,
to tell us how far these cells have changed, how deep it has gone. And then beyond that, we can offer the treatment.
and then if it's caught early, there's a great chance that you survive.
Oh, yeah, because this is a very slow-growing virus. Like I said, it takes up to anywhere from 3 to 7 years for it to become anything concerning, meaning cancer. So it's once it's caught early, your survival is pretty good.
All right. So talk to us again about conserving the uterus in women who want to keep their cervix.
So conserving the uterus really has to do with the stage, or our suspicion for spread. If we think it's only localized to a small portion of your cervix, then we will just remove the cervix and conserve your uterus. But if it has spread beyond and gone to other structures near the uterus, meaning it's gone into the womb, or it's gone to your ovaries, or it's in your lymph nodes, then you really don't have an option of conserving the womb. You have to have everything removed, otherwise then it can spread and kill you.
I see. What happens if you're pregnant and the pap smear is abnormal?
This is a very good question. It's something that I see on a regular basis.
Okay.
So let's say the pap smear is abnormal, depending on what they tell us.
Right.
Because when you're pregnant, that whole unit, meaning your womb and your cervix, has a lot of blood flow. So we will look to see if we see any visible cancer.
Right.
If we don't see any visible cancer, then we do the colposcopy to look. That's what I meant by we will look. Do the colposcopy to look with the microscope.
Okay.
And if you don't have any visible cancer, at that point, we don't do any biopsies. We just observe you till the baby is born. Then we go back and look again. But let's say we look and we think you have cancer or you have lesions that look very concerning, then we may take the plunge and biopsy, and then based on the results we may tell you, okay, this is how far we think this thing may have spread, so you can carry the baby to a certain extent and we'll deliver you sooner so we can treat you, or we will let you continue till, if it's not too concerning, till your full term deliver, and then we go back and treat you.
So depending on the
stage,
decision
right.
It could affect,
or the suspicion.
Right. It could affect, and that could affect the pregnancy or the
mom,
fetus, the baby, right?
And sometimes, if it's at the very beginning of the pregnancy, we think that this is full-blown cervical cancer, the mom may have to make the difficult decision, of choosing her life over the growing child. Hopefully, it won't come to that, but sometimes these things happen.
Okay. Now, let me see. I think I have another question here. I think we covered it. So, at what point do you hand off to an oncologist? Okay.
So, at the point where I have done the pap tests, I have done the colposcopy, and I have done the biopsies. If the biopsies come back pre-cancer, then I would typically treat the patient, because we commonly do the lead procedure or the cold knife cone biopsy.
Okay.
If the cold knife cone biopsy comes back telling me that the patient has cervical cancer, then I refer them to the GYN oncologist.
Okay.
That is a gynecologist that has been trained specifically to handle gynecology cancers. Okay. Also, if I do a pap smear or I just took a look at the cervix and it looks full-blown cancer, I will biopsy for it to be evaluated. Once the results come back that it's cancer, then I refer them.
Interesting. So from that point, the oncologists
will take over,
in.
and they will do the surgery, and they will do the different treatment options that the patient may need based on the results. So some of the treatment options you may have is, besides surgery, you could have chemotherapy, you could have radiation to that area.
Okay. So now once we go into treatment, we're talking chemo, we're talking radiation and all that. And kind of similar to what the discussions we had from last week, right? It depends on the stage and how it's going to affect daily activities and all that. Okay. Now, can treatment put you into menopause, early menopause?
Yes, it can, depending on what kind of surgery you have. Let's say we remove your ovaries.
Right.
Definitely, you will go into menopause the minute we take out your ovaries.
Okay.
But if we leave your ovaries behind and you have radiation, the radiation can also have some effect on your ovaries as well. Okay. So it can cause maybe early menopause. It may be a slow progression, but it will happen sooner than later. Or it may stop it abruptly altogether.
Okay.
Because some of the radiation may go to the ovaries as well. Remember, they all live in the same area.
Right.
Right. So, yes, depending on the treatment you have. And sometimes the chemo can also have an effect on it. But not so much the chemo, more the radiation than
more
the chemo.
More of the radiation. Okay. All right. This segment is usually for 1 hour, but we have so many questions that we'll take another musical break, and then we'll be right back. I'm going to open the phone lines. The number is 848-224-2533. If you have any questions that we haven't discussed and you'd like Dr. Azu to touch on, kindly call this number, 848-224-2533. I know we've touched a lot. The segment usually ends within an hour or so, but hey, if this saves a life, why not?
Blend Sunday, the best of curated high life music on Mustbe5 Radio.
This is
Mustbe5 Radio.
Safari Blend Sunday. We're talking cervical cancer. And I do have a caller on the line. Thank you for calling. Please tell us your name and you can ask your question.
Yeah, my name is Owen. Mr. Magic, thank you for taking my call. Dr. Azu, I have a friend who is currently pregnant, and she was concerned about whether two questions, I guess, whether she could pass HPV on to the baby, and whether she has to have a C-section because she has HPV.
Thank you very much, Mr. Owen. This is a very, very good, important question because I get that all the time. Now, we have to remember that HPV is very common. So a lot of women will be exposed to it in their lifetime. A lot of women, too, will have children in their lifetime. So there's been a lot of studies on this subject, and we know that, yes, there is a risk of passing the virus to your baby, but the risk is very, very low. Even if babies are exposed, the virus usually stays in their oral cavity, and they are usually able to clear it on their own. Most of the time, they don't have any subsequent health complications from the exposure. It doesn't mean that it may not happen in rare instances, but most women do well and the babies do well as well. However, if let's say you have the virus and you have concerns as to the route of delivery, be it vaginal birth or cesarean, having the baby vaginally is pretty safe because you know that the risk of your baby getting exposed is very low. Can a woman opt to have a cesarean for this risk, for this reason? And women always have the right to request for a cesarean, but it's not necessary to have a cesarean for the reason of having a HPV exposure, because chances are your baby will be fine. So we would not routinely do a cesarean based on that fact alone, unless the patient requests or we think that it will benefit her and the baby overall. I hope that answers the question.
It does. I thank you very much,
You're
Dr. Azu,
welcome.
for your time.
Thank you. Thank you, Owen, for calling. Thank you so much. It's been wonderful. Cervical cancer. I hope we've shed some light on the topic. I want to say a big thank you for tuning in. Thank you to Dr. Azu for coming to us in the studio and answering questions. Well, if we get any more questions, we'll be happy to forward them to you so you can answer them. And one final word to the listeners and to cervical cancer patients.
Thank you very much, Mr. Magic. It's been a great time talking on this subject. And thanks for listening, all Mustbe5radio listeners. Well, if I have one word of advice for most of my female patients out there, please, please, please make sure you go in for your routine GYN exams, because not only are we just doing a pap test for you, we're doing a thorough pelvic exam, and we can determine other things that could be going wrong in the pelvis. In addition, this could save your life. Also, if you smoke, please, the only advice I have is smoke cessation, because that can also help if you have been exposed. And if you have children, I do encourage you to get them vaccinated, because if you do get all our sons and daughters vaccinated in the next couple of years, meaning 30 years down the line, this virus will be endemic, and we may not be even talking about cervical cancers. So that's something very simple that we can do to help everyone. Thank you so much for having me, Mr. Magic.
Thank you for coming in. It's a pleasure. It's been a pleasure. And hopefully we'll have you on one more time to talk about other issues. Thank you and enjoy your Sunday.